This is an ABC podcast. It's said to be the most common hormonal disorder diagnosed in young women. Polycystic ovary syndrome, sometimes known as PCOS or PCOS, is associated with weight gain, irregular periods, acne and signs of excessive male hormones. PCOS is often thought of as being underdiagnosed, but a new study of Australian doctors has found that many are concerned it is in some cases being misdiagnosed or overdiagnosed. Researchers at the University of Sydney interviewed GPs, gynecologists and endocrinologists and found that there is still a great deal of uncertainty and even some disagreement when it comes to making a diagnosis, and among patients, misconceptions about the condition, including its impact on fertility, are still fairly widespread. Tessa Kopp is a research fellow at the University of Sydney and she led this research, and I spoke with her a little bit earlier. She began by telling me what PCOS is and how it's diagnosed.
Polycystic ovary syndrome is probably the most common hormonal disorder affecting reproductive aged women. There's a few different criteria out there, but probably the most common diagnostic criteria requires 2 out of 3 features or criteria to be met. So those include irregular cycles. There's also polycystic ovaries and ultrasound, or signs of excess male pattern hormones. So that can be either symptoms of excess testosterone, such as acne, excess hair growth, hair loss for some women, or it can be higher levels of androgens in the blood results.
Okay, and so meeting two
out
of the 3.
Yep.
Okay. And what makes the line seemingly blurry around diagnosis? Because a lot of the clinicians that you spoke to said that there is no kind of clear line, or it can be hard to see.
Yeah, absolutely. So a lot of clinicians talked about how they often saw women for whom the diagnosis was unclear or it was uncertain. So the thing about PCOS is the symptoms are on a spectrum of severity, so they can really vary in the degree of severity that women are affected, and it can be unclear when normal finishes and the abnormal begins, and these symptoms can also change over time, and they're influenced by a number of factors such as weight, ethnicity and also your age.
Right, and presumably things like irregular periods, weight gain, acne, they're also things that are just quite common for young women of a reproductive age. So I imagine that also makes it quite challenging in working out, okay, is this just normal or is there something else going on?
Yeah, absolutely. That's right. So these symptoms are very common during adolescence. So sometimes it might need to just note the adolescent at risk and follow up over time to confirm the diagnosis, because certainly irregular cycles and acne are very common during adolescence.
And polycystic ovaries themselves, they're not necessarily an indicator of the condition either.
No, so unfortunately the name is quite inaccurate. So you don't have to have polycystic ovaries to have polycystic ovary syndrome. And actually lots of women without PCOS can have polycystic ovary findings on ultrasound. And so some studies have found that they're quite common in younger women. So they've been described as kind of a common age-dependent finding. Mm-hmm. And also another thing to consider is that the ultrasound technology we're using is becoming more sensitive as it advances. So that has resulted in picking up more and more follicles, kind of artificially increasing the number of women with polycystic ovaries found. So that threshold for what's considered to be polycystic is constantly needing to be revised.
And given the uncertainty around the kind of diagnostic criteria, do we think that this is leading to mostly a problem of overdiagnosis or underdiagnosis?
A lot of clinicians raise concerns about underdiagnosis. So, for example, some women might not know that irregular cycles are something that should be discussed with their doctor. However, others were also quite concerned about overdiagnosis, so giving women a diagnosis of a chronic condition that will stay with them for a long time but might actually cause them more harm than benefit. And with regarding misdiagnosis, although PCOS is very common, there are lots of other factors or symptoms that can mimic symptoms of PCOS. So, for example, eating disorders, doing too much exercise, obesity, stress, thyroid issues. There's a range of factors that can kind of cause symptoms suggestive of PCOS, so it's really important to kind of exclude those alternative explanations.
Going just back quickly to overdiagnosis, what would cause more harm by having that diagnosis given to you?
Yeah, so essentially we're turning women into patients. And so for some women captured by this definition, they don't actually have the same increased risks of associated long-term implications that kind of fit the more narrower criteria.
What are some of those long-term implications?
So these include things like type 2 diabetes, metabolic syndrome, and those sorts of metabolic consequences.
Yeah, and potential consequences for fertility?
That's actually one of the issues that was raised by clinicians, was that a lot of women, there's a lot of myths and misunderstandings surrounding the diagnosis, and the big one was women thinking the diagnosis would mean that they're never able to have children naturally, but that's actually not the case. So whilst it may take a little bit longer, or they might need medical assistance to help them ovulate, most women will achieve their desired family size, with a recent community study in Australia showing that women with PCOS had similar numbers of children to women without PCOS.
And what do you see as the potential harm of being given that diagnosis, the misconception being I'm not going to be able to have children, or it's going to be difficult? Do you see that then have impacts on women's reproductive choices, for example, or their contraceptive choices?
Yeah, absolutely. So we actually conducted a qualitative study with women and found that fear of infertility had a huge impact on a lot of different areas in their life. So for example, it caused long-lasting anxiety, pressure to conceive earlier than their peers, difficult conversations with their partners, impacted the way they thought about themselves. Some women reported changing their parenthood goals, so no longer deciding to have children. And also something that arose quite frequently was taking risks with contraception due to the perception it's not necessary. And so 3 women out of our small sample of 26 had unintended pregnancies. And because they then believed their fertility to be reduced, they continued with the pregnancy because they were worried it might be their only chance of conceiving. So as you can see, it can have lifelong implications in terms of their life choices and educational attainment.
One of the issues that the research kind of raised was incorrect self-diagnosis. How common do we think that happens?
So this was a qualitative study, so I can't say how often this is happening, but the fact that many clinicians kind of raise it as an issue gives an indication that is something that needs to be addressed. And I think there's a lot of poor quality information online. And so if women Google irregular periods or polycystic ovaries, the first thing that pops up is polycystic ovary syndrome. So I think it's important for women to know that there are a lot of other factors that can cause the symptoms, and it's important to get a full workup with their doctor to explore alternative reasons before kind of assigning that diagnosis to themselves.
It's interesting with self-diagnosis. It makes me think about how period tracking apps have really taken off in recent years, and how these don't necessarily just offer now data on your menstrual cycle, but they offer kind of tools which say that, you know, your irregular periods might suggest you have a hormonal disorder. Does the use of those apps concern you in terms of if they're medicalizing rather than just offering data?
Yeah, so I think whilst it might be useful for some women who are underdiagnosed and for whom the diagnosis would bring a lot of benefit, I think it also has the potential to cause a lot of unnecessary anxiety and distress, particularly with regards to their fertility.
Given seemingly the confusion from both clinicians and also from women themselves, what is the solution here? I mean, do we need to kind of rethink the diagnosis of this condition?
Yeah, I think it's really tricky because it is a syndrome. It's not a distinct disease entity, I suppose, and symptoms are on a spectrum of severity. So I think we need to take kind of an individual approach. So for each woman, weigh up the benefits and harms of the diagnosis and how much this is going to help her. Because for some women, it does bring a lot of benefit. So, you know, it validates their experience and provides, you know, relief to have an explanation for what's going on. Whilst for other women, it can kind of only cause increased anxiety and worry about the future, which is potentially unwarranted.
Keza Kopp is a research fellow in the School of Public Health at the University of Sydney. You're listening to RN's Health Report with me, Olivia Willis, sitting in for Norman Swan.